Hello guys, it's Unit 4 Part B.
Management of labor. This management of labor consists of 4 stages. The first stage, which is also known as cervical stage or premonital stage, and this begins from the onset of labor to the full dilation of cervix. That is, from the onset of labor is nothing but when the pain begins, when the delivery pain begins, from then to the full dilation, when the cervix opens fully, till then it is considered to be the first stage. For premigravidal, that is first delivery women's, this stage occurs around 10 to 12 hours. When the pain begins like 1 o'clock, then the full dilation of cervix occurs at 10 o'clock. Around 10 to 12 hours, this first stage will be occurring. For the multigravidal women, that is for second delivery or third delivery, this will be occurring around 5 to 6 hours. Sign and symptoms of onset of labor. What are the sign and symptoms that is seen in the first stage? The first one that is very important, that is lightening. Lightening is also known as welcome sign, and this sign is not seen when there is an abnormality in pelvic, that is cephalopelvic disproportion, that is the pelvic is not in a proper condition. For example, if somebody is handicapped, then their pelvic will definitely will not be in a proper condition. For them, this lightening condition will not occur. What is lightening? Lightening is nothing but you will feel very light. That is, at the period of 9 months you will be carrying the baby, you will feel very heavy, but at the end of the delivery the baby will be coming out, the baby will be moving downwards, so you will feel much lighter in the stomach place. That is lightening. And next is frequency of maturation. Frequency of maturation is nothing but urination. You will be frequently going for urination. And next, constipation. Constipation issues will be generally for many women's. Lack of water is the reason for constipation. And pelvic pressure. When the baby is moving downwards, you will feel the high pressure in the pelvic. Since the baby is moving downwards, you will have leg pain, leg cramps, and edema is also possible. And it is also main like cervical changes. What are cervical changes? In cervical, you can see the dilation. Dilation is nothing but the opening. First, it will begin with one finger insertion. One finger insertion in the sense the cervix will be opened 1.5 centimeter. In further going on, it will be two finger insertion, that is 3 centimeter. That is nothing but on progressing of labor, the cervix will be slowly starts to open up. Next, false pain is also seen in this condition, and mood swings is also seen. We need to provide them confidence. They'll feel very anxiety. That is the main mood swing, and we need to provide them emotional support. They will have labor pain, and this labor pain will be around 10 minutes of interval. Like in each 10 minutes they will have the pain, and this pain will last for 30 seconds. And the delivery progressing, the 10 minutes gap will be reduced to 2 to 3 minutes. And next, there are few blood stains also seen in this process. And then effacement of cervix. Now we are going to see the difference between false labor and true labor. False labor is nothing but we will feel the pain, but delivery doesn't occur. Whereas true labor is nothing but you will feel the pain and the delivery also occurs. First, contraction. Contraction is nothing but the muscles expand and then contract, that the hardness, and that is present in both places. You will feel the pain in both. Yeah, it's very painful. Pain is also seen in both sides, yes. Regular contraction is also seen. Regular contraction in the sense for 10 minutes. Per 10 minutes you will feel the pain. That is seen in both. But the difference is the retraction and dilation of cervix is absent. Retraction is nothing but suddenly the abdomen muscle, that the pelvic muscles get hardened. Suddenly that gets tightened. That is absent here. And it is present in true labor. Whereas the dilation of cervix is nothing but the opening of cervix. The cervix slowly gets opened. It's because the baby is coming out. So the cervix gets opened. That is absent in false labor, whereas it is present in true labor. Preparation of labor room. Labor room should be very clean. That's very important. Next, avoid the unwanted visitors and unnecessary peoples. Good artificial light is very important, because natural light will not penetrate into this room, so artificial light should be good, and necessary drugs and machines should be arranged by the nurse, and mainly the delivery kit, and emergency equipments and drugs should always be present in the labor room. This is the preparation of labor room. Preparation of woman. When the woman come to the hospital, the very first thing you need to do is admit her and then check the vital signs. After that, you need to ask her relatives to provide the previous antenatal records. After that, you have to provide the gown that is provided in the hospital for delivery process. That is the dark green color gown you need to provide to that woman. After that, you need to do the vaginal examination and then shave the perineal area. Perineal area is nothing but the external sex organ, that is vulva, and you have to place the sterile pad over it. Sterile pad is placed over the vulva because there will be a discharge, so we need to place it. And emotional support is very important because at the time of labor, definitely every woman will be having anxiety. Even though it might be our second or third delivery, still she will feel some kind of anxiety, so we need to provide emotional support. After that, we need to check whether the bowel movement is present or not. If there is an absence of bowel movement, if she is suffering from constipation, we need to provide her enema. And this is the preparation of women. Questions will be provided at the end of the chapter. Until then, stay tuned. Meet you in the next video. Bye.